Unfortunately, I lost my mom to cancer, and one of her first instinctual habits when she was diagnosed was to go online and search what remedies are out there, what treatments are out there.
YouTube has recently made some changes to our medical misinformation policies to hopefully make these complicated guidelines simpler for creators, viewers, and partners. We streamlined dozens of existing medical misinfo policies on COVID-19, vaccines, and more to fall under 3 categories: prevention, treatment, and denial. And we began to remove content that contains misinformation about cancer treatment. Mike, what's your reaction to this as a creator and a healthcare professional?
Look, I think YouTube's taking a really great stance on this because it's very easy to demonize anything that goes against current modern thinking. But we need to have that debate. We need to be able to have honest conversation. And only when it crosses that boundary where it's causing harms and we see negative outcomes for our patients, then we need to step in and make sure people who are looking for information and are trusting providers on YouTube not be hurt. I see patients that are on all stages of either cancer diagnosis, cancer treatment, post-cancer surveillance, and I see them fall victim to so many cancer treatment scams when it comes to social media. So I think taking a strong stance on this will not only help the people who are struggling with cancer right now, but also the millions of people that are going to be diagnosed with cancer each year.
We know that there are lots of different opinions out there about how to tackle medical misinformation. What are people getting right and getting wrong when it comes to doing exactly that?
Well, it's easy to vilify anything that goes against current standard of care. And there needs to be a fine line drawn there because currently we may have certain treatments and protocols for cancer, but those may change. But we need to be able to be open-minded and at the same time not misguide people from actual proven remedies that work. For example, it's often brought up in my patient population that they may be interested in doing some complementary medicine or integrative medicine approaches like massage, acupuncture, some dieting for their foods. And I'm only against this type of medicine if it is discouraging them from getting proven care that will actually prolong their life, improve their quality of life, decrease that risk of mortality that comes with cancer so often.
So aside from removing bad content, an important element of our approach is connecting people to the good content. And YouTube has a range of authoritative health features that medical professionals such as you can apply to be part of so that their videos are more prominently featured in search results. How do these features factor into your content strategy?
It's amazing because what happened throughout even the COVID-19 pandemic, as an example, you see someone don a white coat and immediately it looks like to the layperson that they're an expert. They're wearing a white coat. They must be of some level of high education, but that's not always the reality. So YouTube has taken that stance one step further and have actually labeled who is an authoritative source, who has a medical degree. And because of that, the audiences can know who to trust, where they're getting accurate information from. It also adds a layer of credibility for not just myself, but also the tons of other great medical creators out there that are debunking this information, that are putting forth good information.
So what advice would you give to a health professional who's thinking about starting a YouTube channel?
Please start. Please start. We need more healthcare professionals on YouTube. Google, #1 website in the world. Second, YouTube. If that is where people are getting their healthcare information from, we need to be there as evidence-based physicians to deliver that information.
These are really, really important issues, Mike. So thank you so much for taking your time to discuss them with us.
This is incredibly nuanced conversation because you want to be able to leave room for debate and new ideas and provocative thinking. But at the same time, you don't want to allow misinformation space to flourish and go viral.